remember the last time I even uploaded to YouTube. But as I walked down this street, just thinking about how unserious the people around me is taking this, and how they don't want to hear the opinions of the scientists, not necessarily the news, not necessarily the government itself, but the scientists, the people who's not even basically in government the way we think. People don't want to hear what they're saying. People are instead ignoring their advice, their expertise, their knowledge. So people are downplaying this more than what it is. They're downplaying it to the point as if to ignore that this thing is killing people. Yes, we don't want to make people panic, because I certainly don't. It's not why I'm speaking out. I'm speaking out because we can lower the risk of the people that get infected or the people that die by just taking expert advice, by just taking this a little bit more serious than what people are. You know, I keep hearing this, the government invented this, and I keep saying, okay, say what if they did? If they did, there's nothing anybody can do but try to be safe. That's it. That's it. It's not like people can run up some government facility and just make this all end. But me, I'm not with that conspiracy stuff right now. Even if I once say I was a person that believed it, just not with it right now. I would rather be safe than sorry. Speaking of all that conspiracy stuff, nobody can do anything but talk about it. But what people can do is take precautions to be more safer. And I haven't uploaded to YouTube for years. So you know things have changed. I'm doing this because I don't think the people that I see and the people that surround me, others, are not taking this serious. Taking something serious does not mean be afraid to live your life as if you're trapped. No, it means take precautions. It means social distance. It means washing your hands, wearing a face mask. And I've been telling people for a while now, and the first expert I ever heard said he would recommend people wear masks. This is before they changed it to what they're recommending now. So I've just been listening to the experts. I don't care about what the news has been saying. I don't care about them sensationalizing things and scaring people. I don't care about that stuff. That's the news. But I do care about what experts in this field. I'm talking about people that's been in this field for 20, 30 years or more. I care about what they say because they know about this stuff. Many of them have warned about this possibly taking place. So that's why I'm not worried about the conspiracies either, because that's not going to help us right now. Sounds good, makes us feel good, but I'm sick of feeling good about stuff. I'm sick of that. What I think we need is to take more precautions and to really, really, really do what's necessary to try to get through this. There's no vaccination for it yet. I know we have our anti-vaxxers. That's cool. I don't care. But trust me, all the people talking that BS, anti-vax stuff, if they don't get sick before they get a vax, because once you get a vax, if you get sick before you get vaccinated, it's too late. But I bet you if they come out with it, most of those people, unless something's wrong in their mind or they totally convinced that the vaccines poison people, I can guarantee you that most of those people will be jumping on that vaccine. I'm just sick of the BS. There's people right now, there's people that I've seen for years, and that they have it. They have test positive. And I don't want people to live under this false illusion either, that because they have a face mask on, they should be outside more. They should be at grocery stores more. Pack up on a lot of stuff where you don't have to shop as much. Get as much bulk stuff as you can. Stay out of the way. And then when you take walks, just social distance. But when you're not, you don't need to don't go to the grocery store just because. And I know it's hard for people to adapt to this. This is not easy. I mean, we have to change the way we interact in society right now. So that's not easy to us as people who's used to interacting with each other on a day-to-day basis in the normal way that we are accustomed to. So I understand all of that. That's not my problem, though. My problem is we have to. We have to. And I know they're working on the viral medicines, and seeing what works and what doesn't. And they're experimenting with lupus and AIDS medicine and malaria medicine to see what works, and it can't be anecdotal like that. I mean, it has to be real evidence-based, so that's going to take time. And this is what they're trying to put out there before the vaccines come, because the vaccines take much longer than the viral medicine will. Much longer. About 16 months, if I remember correctly, from studying prior to any of this stuff even happening, before I even knew any of this would take place. Scientists have been saying, scientists in the field of disease has been saying for years, it's not a matter of if a virus will come, but when. And now, or a disease, and now we're living in it. This is not a game. It's not something to conspiracy theorize about. It's not. It's not a joke. Like, there's no time. Take precautions. That's the best measures right now. It's really the best measures. But you got to see that I have to get my stress levels down because I'm really concerned. Like, we have children. Even though they're less at risk than the adults, we don't want parents of these children to be gone, and now the children have no parents. Does anyone ever even thought like that? What about the parents being here for the children? Because just to keep it 100, most people will not care for other people's kids the way the parents, if those parents truly love their kids, the way those parents will. You don't want to abandon your children because you were being irresponsible or because you thought this thing was fake. Which is silly to me. It's fake. Like, it's not happening. Everybody on TV is a paid actor. It's ridiculous. And this 5G conspiracy shit, see, got me cussing. This 5G conspiracy stuff is just as bad to me. Like, it's just as bad. Like, I've been hearing conspiracy theories of this ever since I can remember when 3G was on the market. It's this conspiracy about 3G giving everybody cancer. Not one person I know has gotten cancer from a damn phone. Not that I know of. To keep it 100, everybody around me got vaccinated. Everyone. Everybody. At one point or another. And they're all here. I ain't say vaccines are 100% safe. Nothing is. Nothing is. There's people allergic to peanut butter. And peanut butter's absolutely healthy. It's healthy. There's people allergic to eggs. But it's healthy. So just to say, because something's not 100% safe, it's crazy. Like, nothing is 100% safe. And the arguments I've been hearing against this is crazy. People have been telling me, well, scientists say seatbelts is 100% safe. No, they don't. No, they don't. I could pull out a thing of hand sanitizer, and it says 99.9%. Doesn't say 100%. That's the difference between people that see reality for what it is and people that don't. That's the difference. People that see reality for what it is knows nothing is 100%. You can't guarantee something 100%, but you can measure up to be more safe. That's it. You can't do nothing more and nothing less than that. You can only be more safe. That's it. No one says that you could be 100% safe with anything. It's just better to be more safe. A seatbelt is not 100% safe, but it's better to have one on than it is to not have one on. It's just like having sex. Having a condom on, that's not 100% safe. People should know that, but it's better to wear one than it is to not use it. Like, come on. This stuff is ridiculous. Just the arguments for people to rationalize why they should not be responsible for being more safe. I know we all want to do what we've been doing. We all want to. We all want to just be normal. Who doesn't? Who doesn't want to live a normal life? But right now, that's not what's in the plans for us. That's not the reality right now. That's not what is actually happening. So we have to take precautions and just do our best with what we have so we can get through this. So more people can live. Gloves, wear gloves. After you done touch something and possibly contaminated your gloves, discard them and throw them away. Not on the ground, not just any old where. Wash your hands, the 30-second rule or the 20-second rule. Wash it, soap on your hands for 20 seconds and then another 20 seconds washing them. Get in between your fingers. Scrub your nails onto your skin while the soap is still on it. Get the back of your hands. Your fingers. Get everything. 20 seconds. They say sing the happy birthday song. That's about 20 seconds. So sing it when you put the soap on. Sing it when you're washing the soap off. Like, that's the best that can be done. Like, just take measures. Disinfect counters. Light switches. The things you touch the most. The things that are being touched the most in your house or wherever you are. Because everybody's not fortunate to be in a house like we are. Some people, they're not in the house. Which is even worse. Because now they have to suffer through whatever they have to suffer through during this pandemic. It's not something little. This is global right now. But we have to do what we have to do. And a lot of things are in short supply. You know, respirators and other things that's needed to help people sustain their lives if their bodies can't fight back. Now, yes, I do know the stats and the numbers. I'm not going to come on here and just be ignorant. Like, I know that more people survive this than people that die from it. That's not the point. That's far from the point. Because people are dropping every day from it, though. Every day. It's better when no one is, when little numbers of people are dropping from it. But I know people or know of people who know people that passed. And that, like, from the corona, And that's rare for me, to know people that passed. It's a big difference. So I know people, this is hard to adjust to. I know it's not easy. It's not a simple matter. It's not. But you have to do it. I mean, if you have your family, you want your family to be safe, and then they don't infect other families, because that's what keeps everyone else safe from not affecting your family, and then your family possibly infect other people, then you have to do what you have to do. You have to take precautionary measures. You have to. And that's the thing. So no, don't panic, but still take it serious. That's two separate things. But people think that those who are taking it serious, that they're panicking. No, it's two different things. You know who the people that panicked was? The people that bought all the damn groceries. As if food's running out. Food's not running out in the U.S. A lot of our products, because they're manufactured elsewhere. But food's not running out. Toilet paper's not running out. It's like last time I read, I remember, there's like 100 years worth of toilet paper in stock. So toilet paper is not going to run out. When you see the stores not having stuff, that's because people are buying it faster than it can be shipped in. Not because suddenly it's gone. Not because it's running low. It's not running low. It's not running out. The fact is, people are just buying it faster, products faster than they can be stored in a store. And that's a problem. So, that's my entire issue. If more people would just take the measures that they're asking, the counts, the spread can go down. That's it. Nothing more, nothing less. Nothing less. And once the counts go down, do not become comfortable. Do not give yourself a false sense of safety and security once the numbers start dropping. Because we're doing this quarantine and people are self-isolating. Don't let that trick you, because the moment people start gathering again, until a vaccine comes and people start getting vaccinated, but until then, the moment people start gathering again, the numbers will start to shoot back up. It's just logical. I'm not going to say common sense. I'm going to just say it's logical. Even though some people think they link common sense and logic to each other. And I have my own kind of definition of common sense. Sometimes common sense is not common until you experience whatever it is that you have to experience to say, now that's common. For instance, touching the stove when you're a child. Some people will say, oh, that's common sense because it'd be hot and you'll get burnt if the stove is hot. But for a child, that's not common sense. But after that child touches it, then that becomes common sense in that way. But still logic, because you know it hurt. So I'll just say logic across the board. But this is serious, y'all. It's really serious. We got to get off these myths. Talking about people like Idris Elba got paid to pretend like he had corona and that he walking around fine. Yes, because he's asymptomatic. People don't realize being asymptomatic is not a new term. It's not new. Like, it's been known that you could be people can be asymptomatic to certain things. You know? They can. They could be asymptomatic to lots of things. You know? So, when they say asymptomatic, that means they can catch it, spread it, and not have a symptom. Also, people that are pre-symptomatic, they call it, don't have any symptoms yet. They will develop symptoms, but they don't know they have symptoms yet, and then they spread it. Then suddenly they start having symptoms. So these are the various ways that it's spreading. That's why it's good to keep the mask on. The N95 masks are the best, but Those are in low, only government officials are getting them right now. Certain places have them here sparingly, but they're trying to give them just to government officials or nurses and doctors and things like that, which is understandable. Because if the doctors and nurses are sick, people can't be looked after. People can't be helped through this pandemic that might survive. So that's understandable. But there's other ways. These wearing a mask is better than wearing no mask at all. Don't get me wrong. But cotton masks and out of shirts and bandanas. I think the corona's like, the virus itself is like 0.1 micron or something like that. And it can seep right through cotton, bandanas, shirts, socks, whatever. Like, there's other methods, and I don't want to push them, but you can look them up. There's other methods. But as people learn these methods, they'll buy up everything that you can possibly go out and get in order to keep your own selves safe. So you have to get what you have to get and do what you got to do right now. Stay out the grocery stores. Try to come once a week at least if you have to at the most. But if you can avoid even that, do it. Because I know it's not realistic for everybody to be able to go to the grocery store once a week or whatever, because of a lot of people are laid off and collecting unemployment, or they just don't have a job. So that's not realistic for everyone. But either which way, try to minimize your activity in places where a lot of people are. And they say stay at least 6 feet. I've said from day one, if they're telling me 6 feet, I'm giving it a few more feet. And if somebody sneezes, I'm gone. I will run from a person like that, even if it makes me look negative, which I'm not. But I'm trying to preserve my life, if possible, so I can preserve the lives of those around me. First, my kids, and my fiance, and everybody else who's interconnected to us. Because that's just the way to go. But when people just want to keep interacting without precautionary measures, that makes it dangerous, more dangerous for everybody else. And that's what I've been saying. And I just had an argument about this with somebody who basically said this is bullshit. They basically were saying they didn't care about what happens to the kids, and they did say it, even though they might deny it now, they did say it, and that because they're healthy, that they ain't worried about it. Well, I am. I don't care. No doctor told me I was unhealthy, even though I'm an asthmatic, but no doctor has told me I'm in poor health. When I get checked out, I'm always clear that my health is pretty good. Everything pans out pretty fine. No scares or anything. But that don't mean because you're healthy that when you get it, if you get it, that you'll just fight it off. That's not what they're saying. They're saying it's a lesser chance because you're healthy. They're not saying that because you're healthy, you can't have adverse effects. Like that it can't stain you when it can. So I don't understand this craziness. I just don't. And I'm frustrated when the people who's around me, the ones that I'm trying to protect, think I'm just being an asshole. That's crazy. That's crazy. I remember watching movies on subject matters like this. And people would look at the people in the movie doing what they're now doing and say, what are they doing? They're being stupid. But now they're basically doing the same thing those people were doing. And I don't understand it. Like, most people can only, because most people don't self-reflect, most people can only see it when someone else is doing it. They can't look at themselves. Which is what I had to learn how to do. Because we were all there at one point. We all were at a point where we didn't self-reflect. But it takes time, patience and a willingness to do so. Most people don't. They only see what other people do and not what they themselves do. So I'm taking this serious. I don't want to touch anybody. I don't want anyone touching me. I don't want to be in a public place such as a grocery store or anywhere I don't need to be. I want to be there as less as possible, not as often as possible. I don't want to have a face mask on and allow that to give me a false sense of security and safety. No. Sorry, y'all. Those measures are only put in place to make you more safer. But you can't guarantee anything 100%. So the less places where people are, such as grocery stores, because now someone coughs, it's inside. It's not like it's outside where the wind may blow. And so it's not trapped in one place, a confined area, because that's what makes it more dangerous. And then people who carry this usually don't know because symptoms don't come on until later. So we got to be more precautious, not paranoid, not scared. That's two different things. Precautious. Anyone who's has any logic will just want to preserve self-preservation. They would want to preserve themselves. So they're here, especially if they have kids, a family, a mother, a father, a brother, a sister, a cousin, any of that. They would want to self-preserve so those people have a better chance of not being infected. Because the more people that's infected, the more people can spread it. And I just want to keep it real. This thing's no joke. And there's people that's fighting. And I did the studies. And they said this thing can cause brain damage to the brain in certain ways. Maybe rare, but it can. But I know in severe cases, in your mind, people's lungs have been damaged so bad that it looks like a beehive. Those people will never, ever be able to walk around and be normal again. Ever. It's a wrap. That's it. And if anybody ever had a breathing issue ever, they would know with your lungs still totally intact how hard it can be if it gets attacked by something, a virus, not even this virus, but any virus or anything that does harm to the system, pneumonia or anything that causes your breathing, a person's breathing, to become problematic. They know for a fact that it's not good. So imagine something like this that attacks the respiratory system way more than things that have a lesser effect on you. You know, because it is like the bronchitis and the pneumonia, it causes that to happen to a person until they, until they're so sick that they might not be able to fight back. Because it attacks the cells in the body. It makes your body go into hyperactivity, basically. And your body can't fight off things when it's hyper like that. Your body has to basically be calm enough to do what it does to fight what's attacking it. So that's what makes this detrimental. That's what makes this dangerous. And that's why people need to take it serious. I'm going to keep saying it. It has nothing to do with paranoia or being scared. People just need to take precautionary measures. Just be cautious. That's it. Do what you have to do to try to not have this thing spread. That's just the reality. I haven't made a video in years. Not like 3 years. Not like 4 years. Way longer. So you know I have to be taking something serious. So that's all I wanted to say. I want y'all to really take a look at this. Stop, please. Stop the conspiracy theory stuff. Even if it just suspend it for a while and take precautions. Knowing saying what the government may be doing is not going to change it. It's here now. That's all I needed to say for now. Peace.